Welcome. I am Jamara Nettles, and I was lucky enough to interview Jennifer Liposhak. Jennifer currently works for the Idaho Department of Health in the Public Health Division. She is the Women and Infant Health Program Manager in the Maternal and Child Health Bureau of Clinical and Prevention Services. When I interviewed Jennifer, I asked about her job at the Idaho Department of Health. She shared two of the large projects she has worked on in her time there. She oversaw the Maternal Mortality Review Program Committee while it was active. There, she, several healthcare workers, and community members reviewed maternal mortality cases and provided insights and suggestions on what could have been done to prevent the deaths and proposed changes to prevent future deaths. She worked on this committee until legislation ended the program. Recently, she and her team established Idaho's first perinatal qualitative collaborative, also known as the PQC. This program works to bring clinicians, healthcare providers, communities, organizations, and public health officials together to create evidence-based quality improvement initiatives for specific issues in maternal health care. Looking back at how Jennifer got to her position now, she shared that she didn't start off as a public health major, but that she got her bachelor's in an unrelated health field. After taking some public health classes and an internship at the local health department, she fell in love with the public health field. From that internship, she got a job working at that same local department and over the years worked her way up to the state level she is at now. She emphasized how grateful she was for the internship and the first-hand experience it provided, and the relationships she gained while there. While discussing her day-to-day tasks and responsibilities, Jennifer explained how her day-to-day can fluctuate depending on the season. Sometimes she is very focused on gathering data and putting reports together for grants and other agencies like the CDC, and other times she is receiving reports and data from local departments and programs and figuring out how to allocate funds. More consistently, her job consists of facilitating meetings, conducting needs assessments, creating and reviewing quality initiatives, along with other typical job duties like managing emails and phone calls. When I asked Jennifer about the hardest part of her job, she mentioned the struggle of working with and around politics and policies. A lot of her job is based on legislation and what they are willing to fund and support, and the process of convincing them to do so. She said it can get very frustrating to have to continue to advocate for things that seem like basic needs and rights. On the flip side, when I asked her about her favorite part of the job, she said it's working on the big picture scale and helping create a space for collaboration and communication. She said it is rewarding to know that the work she's doing is going to impact many people for the better and hopefully create lasting change. When it comes to joining the public health field, Jennifer's biggest suggestion for anyone thinking about it is to get real experience whenever possible. Whether that's through school, internships, volunteering, or even starter jobs, most employers are looking to hire people who have real experience. She also suggests networking and finding mentors who can support your growth, as having people who are willing to help and further your education will go a long way. While having a degree is important, Jennifer also mentioned that certificate programs to help prepare you for things like leadership, grant writing, and even policy writing are things that will set you apart from other applicants. While Jennifer's job as a Women and Infants Health Program Manager is very interesting, I don't think it's the job for me. There are many perks to her job, like having a 40-hour work week, flexibility with working location, and the creation and implementation of large-scale programs. However, I think that I would like to work on a smaller scale, with more one-on-one communication with the community, less administrative tasks like grant and policy writing, and more focus on education and advocacy. Big thank you to Jennifer for taking the time to meet with me and answer my questions. Thank you for watching.